It's an independent, non-partisan think tank founded by Philip Blond in 2009, and its work is based on the premise that human relationships should once more be the centre and the meaning of a society based on the common good. So it's not necessarily your typical think tank, and this isn't going to be your typical session on social care. This fringe is delivered in partnership with Home Instead, one of the UK's most respected home care providers, and with KeyRing, an organisation whose support for people with learning disabilities and others is based upon people living in their own homes, but sharing skills and talents with their communities. So I'm not going to start with the usual list of demographic time bombs, care cost challenges, and a run-through of notable recent care and abuse scandals. If you haven't heard that 20 times in the last couple of days, then welcome to conference. We know that all public services are shaking at the collision point between the plummeting money graph and the rocketing demand graph, and social care for adults is certainly no exception. But it also has the additional burdens of the fact that there's very little awareness of social care, what social care is, or what makes it valuable among the public. And particularly if we contrast this to the NHS, and it's been really interesting to see so many sessions this conference really starting to discuss health and social care together, which I think is very positive. Just briefly, if we look at 2012's NHS hospital, it actually looks very much like 1912's hospital, or even arguably 1812's hospital, just with more machines that go bleep. Whereas social care has transformed itself almost out of recognition in the last 30 years. Closing nearly all of its biggest buildings, it's been learning to treat people as individuals rather than as categories of need, and it's been accepting that people who need support might be better at managing the resources allocated to them than professionals. All of these are fairly radical ideas, and I think they all touch on what we're going to be talking about today. But that revolution in social care is very much unfinished. If you use social care in 2012, you may well be able to take the money instead of the service and be able to spend that money in theory as you see fit. But then, of course, you might find that having the mechanisms of choice is not the same as having a wide and diverse range of services from which to choose. Even if you are fortunate enough to receive a high-quality service that's beautifully tailored to your needs, you might find that having a great service is not the same as having a great life. Most social care always has and will be delivered by families and communities. I think Carers UK value that at well north of £100 billion these days. And as professionals and services, we're only beginning to relearn how to be the servants of those informal support networks rather than their replacement. So we're going to be talking about choice and the interface between choice and making social care genuinely personal today. I'm delighted that our first speaker is Norman Lamb MP, who's held a number of positions within the Liberal Democrats in government, was a very well respected Shadow Health Secretary, and of course this month was made the new Minister of State for Care Services. So Norman, over to you.
Thanks very much. I'm not sure whether I should stand up, or actually if I stand up I will be completely blinded, so I'll sit down again. That resolves that dilemma very quickly. You're absolutely right, first of all, to talk about the revolution that's been underway in social care, and I suppose it's, in a way, what's happening at the moment is a shift from a very paternalistic model where the authority decides what's good for people and provides it, irrespective of what people actually want themselves or what their priorities might be. And actually that sort of paternalistic approach has provided quite a prop for many families. I'm acutely aware, I was in Norfolk talking to sometimes quite older parents of adults with learning disabilities in particular, and who've relied absolutely on daycare to help them survive. And then when they see this potentially disappearing, they get very frightened by it. And I think we have to be acutely aware of that. But there is this shift going on from a paternalistic model to one where the individual can determine for themselves what their priorities are. And actually, although this is something that I think all parties sign up to, I see it as a very liberal approach. It's putting it's giving power to the individual, which is what I want to see in society more generally, and so it's entirely consistent with my sort of philosophical approach. You're absolutely right to say that you have to have both the rights for the individual but also the services then for them to choose from, and I'll come back to that in a moment. But I think the emergence of personal budgets and direct payments is an incredibly powerful mechanism. I remember reading early on Charlie Ledbetter, who'd done a lot of work in the early days about the potential power of this approach to potentially improve health and well-being of the individual and potentially reduce cost. I think since then there's been some doubt as to whether a reduction in cost is necessarily always achieved, but ensuring that payments are directed at what people's priorities actually are, I think, is an incredibly important principle to follow. It's interesting that there's been quite a significant increase in the last 2 years in take-up of personal budgets. That the trend is in a very good direction. The emergence or the development or the increase in the number of people who are receiving direct payments hasn't been as fast. And I was discussing this with officials last week. I mean, the direct payment is the most empowering in one sense, in that, you know, that the person has complete control of the money, of how it's spent. The personal budget, and I'm still learning about this, but the impression I get is that it can be quite variable as to how it's actually delivered and how much real power the individual might have. I'm aware that there are potential real constraints for individuals in taking on a direct payment, in that you start to have to think about the bureaucracy around employment rights. Does an individual, someone said to me the other day, I'm a parent, not a business. I don't want the responsibility of employing people with everything that goes with that. And interestingly, I'd be interested in other people's views on this, a woman with multiple sclerosis said to me that enabling a personal assistant to work on a self-employed basis would be of enormous value to many people in her situation. And I'm aware, since she made that suggestion, that there are very mixed views on this, but I was interested in her perspective on it, and I'm, as a former employment lawyer, I'm interested in how one might make it easier for people in this situation to take on a personal assistant without the burden of employment law and the responsibility that is carried with that. The bill will give a right to a personal budget, which is, again, a good step in the right direction. We are now starting to pilot the idea of the personal budget for care homes, so that you might be able to start to shape what's on offer rather than just, you know, this is what you're paying for, take it or leave it. And I'm attracted by that. Moving on very briefly to the other side of the equation that you talked about, which is, you know, whether there are services that are available. I was excited by what I heard at an event last week I had to speak at. It was about ADAS's work on developing the care market, analysing what is available within the local market, identifying where the gaps are in that market, which might be a way of encouraging providers, new providers, to come into the market to fill those gaps. The point was made that it might even make it easier for a potential provider to get bank finance if there is a clear identifiable need identified by the local authority. This might all be a way of developing the market to provide more choice. Along with that, it's incredibly important that citizens have access to information about what's available, and the local authority, I think, can play a real role here. I've made the point in other fringe meetings that I have a 93-year-old mother in Norfolk, and we are now at the point of trying to find care support as her need might increase over the years. I have no idea where to go. I happen to be the care minister. I have no idea where to find appropriate care, what the quality of that care might be like. I'm in a complete vacuum, and that needs to change. And I think the local authority can play a really powerful role in facilitating access to a range of services, and also giving a platform through a portal to micro providers as well, who might never get heard of at present. The final thing I'd say is the application of this principle of personalisation within the health sphere. You'll be aware of the personal health budget pilots. There's, I think, about 60 of them around the country, particularly around people with long-term conditions. But again, as a Liberal, I'm very, very attracted by the concept. I realise it can't be applied across the whole of healthcare, and there is, one has to be cognizant of the need not to undermine absolute core services. But I think I was given a case study of two twins, actually, in their 20s who had acute care needs. They were both in receipt of a direct payment within the social care system. They had their own team of carers. Everything was working brilliantly. Their need increased to the point at which they became entitled to NHS continuing care, at which point everything was lost because the NHS would not allow them to continue to employ the care team. And they were just given what the NHS determined was available to them in that area. And that's appalling. I mean, it's scandalous that anyone could be treated in that way. And so we've got to move away from that one-size-fits-all in health as well as in social care.
Brilliant, thank you very much. We'll take questions for Norman in a moment. While you're plucking up courage to talk in front of this enormous auditorium, I'm going to abuse my position as chair and pick up on the issue of direct payments flatlining and whether self-employment will be a solution to that, widening that. We looked into this with colleagues with BIS and DH for a resource around micro-enterprise and found that the employment law barriers to that were pretty intractable, but that micro-enterprise approaches were one way through that, and I'd certainly recommend looking into those.
So the enterprise is providing a service.
Yeah, exactly. The difference being that that you can provide a service to a number of people on a self-employed basis, whereas if you are working with one person at their direction, you're employed by them, whether you or they like it or not. Seems to be the BIS and HMRC line on it. There's a map for micro-enterprises available on our website. Right, I'll stop abusing my position as chair and take questions.
Oh, blimey, straight up.
I'm sorry,
this looks like trouble.
Sorry, no, I'm reporting you. I mean, on the direct payments...
sorry, could you say who you are?
Sorry, I'm Dave Warren. I've been a full-time carer for 3 years now. And have looked into direct payments, and we have used direct payments a bit. But one of the problems with the direct payments system currently is the amount of work you have to do as the carer. It actually gives you a lot more to do. Just one example. I mean, we have a bit of a battle actually. We use it as one-off, so we go away for a break, and we used it so that the lady who looked after his daughter could come in and look after her. And Carers UK were saying that was okay. The council first of all was saying it wasn't. You had to go through that battle. And then when you actually do it, we had to put her on the tax, we had to do all the other bits and pieces, insurance for the home, and all that kind of stuff. Now, a lot of people in a situation where they're receiving care, quite often it's two elderly people. And it's just that the same point that I made yesterday, I suppose, at the meeting when Norman did the Q&A. It is a very bureaucratic system, and it's also quite restrictive as well. It's quite restrictive. So if we're going to go down that road, it's got to be easier for people to do.
Right, I totally agree.
So I think there were 2 or 3 questions, so to try and get everybody's questions in very briefly and then give Norman a chance to respond, we'll take them all together, please.
Norman, I'm Adrian James, I'm from the Royal College of Psychiatrists, and in my sort of proper job, I'm a forensic psychiatrist. And 1% of the NHS budget, as you're aware, is on forensic care, 1% of the whole budget. And I work on the principle that those who have least control over their lives should have, wherever possible, the most choice. And I think you talked about it's not possible to roll out choice across the whole piece. People say you can't roll out choice is within forensic services. And I've tried to float the idea that although you can't have choice in everything, that for those who have almost no choice in their life whatsoever, that you could have an element of a personal budget within forensic care, so that you could actually begin to purchase some aspects of the care that you actually get. Because what we do in forensic services, we largely control people's lives and then expect them to get on with their lives when they leave, and they've lost all the skills necessary to do that. I wondered what you felt about that as a sort of pilot in itself.
And there's some interesting work going on around trying to bring the principles of personalisation into the criminal justice sector, and of course choice isn't just the personal budgets and direct payments aren't the only mechanism for choice, I think we're finding as well. So last question for Norman.
Yeah, thanks. Emma Solomon from the Children's Society, and soon we're moving to the National Children's Bureau. Obviously my question's about children and you know, this whole
surprise.
This whole agenda is much more advanced, sophisticated when it comes to adults, less so in relation to children, but there's obvious benefits, you know, particularly from a legal perspective. Those having the least control, as previous speakers said, but importantly they have the greatest choice, or those advocating for them to enable them to have the greatest choice. I'm wondering if normally you could give some reflections on where you think this agenda should be going, where you would like to take it for children.
Brilliant. So 3 questions, very much on message, linking choice with responsibility, sometimes onerous responsibilities, exploring that in relation to groups who haven't necessarily been seen as the natural recipients of choice in the past. Norman.
Yeah, I do think there's a real sort of problem here that the whole idea of personalisation and direct payments and personal budgets is to empower the service user and the carer to make good decisions for themselves. And then we impose a whole load of bureaucracy on them, which makes it unattractive to do. And if they do it, it sort of takes up time that they ought to be using to care for their loved one or whatever. So I think it's a really interesting area to look at how we can break down that barrier. And I'm very interested in the sort of micro enterprise, social enterprise sort of approach. I mean, I'm a great fan of sort of employee ownership as well. I think small enterprises owned by the people who are working in it are very attractive, and there's a question. I mean, we had all of the debate about Beecroft and whether we should be stripping people of employment rights, and I was very clear in opposing that in the wider economy. But when you have a micro enterprise where all of the people working in it own it, do they need to be protected from themselves? It's just a question I pose. And could one therefore sort of provide a mechanism of support to people with personal budgets that impose less of a bureaucratic burden on the carer and the service user? And Adrian, I mean, it's very interesting. Bizarrely in the NHS, the principle of choice is now quite embedded in physical health services, but not in mental health services. And it's bizarre to me that the one group of people who we surely ought to be empowering to make decisions for their own benefit are the people who we still deny choice and empowerment to. And so I would favour trying to find ways of extending the principle to mental health generally. And I'm very interested in what you say about forensic services, and be keen to hear more from you on that. But I certainly am very open to the concept of what you're talking about. And on children, again, the principle is there. As a liberal, I favour giving citizens as much power and control as one can. And so if it's in the family context where a child is still with a parent or carer, giving them as much control over how the public resource is spent must be a good principle to apply.
30 seconds more. We've got one more hand at the back. Can we?
Yeah.
Okay.
Yeah, Norman Graham, like with Sussex again. Sorry about repeating myself, but one of the things that because we've been involved locally with direct payments and so on and so forth. West Sussex was one of the pilots. It's the problem with predatory providers, if you like, and safeguarding people, but trying to keep regulations to a minimum. But there are organisations, individuals out there that tend to play on that.
Yeah.
And when people
Exploit.
are vulnerable,
Yeah.
those safeguards also need to be built in as well.
It's a very good point, and I completely accept it. It's always difficult to get the balance right, isn't it? The bill will include provisions specifically on safeguarding and introduce new responsibilities on the local authority, which I think is all a good thing. But you're absolutely right. There are big characters out there who will seek to exploit if they're given the opportunity. And we don't want to lose this whole principle of giving power to people who in the past have had no power at all. But we need to be cognizant of that.
Yeah.
You mentioned choice in the NHS, and perhaps the NHS has got as far as people having choice as individual consumers, whereas social care, I think, is starting to move towards people getting together into groups and actually having commissioning power, which is a very different level of control and choice and shaping of those markets of providers. Ruth's starting to scare me, so I'm going to say thank you very much to the Minister, and thank you, and enjoy the rest of the conference.
Thanks a lot. Thank you.
I'm sorry I haven't heard from the rest of you. I was looking forward to that.
They're going to be brilliant as well. Okay, so your little lobbying bit there is finished. Every opportunity. Okay, so Victor Adebowale is next, and was one of the first people to be ennobled as a People's Peer in 2001, when he also became Chief Executive of Turning Point, which supports 130,000 people with complex needs, including those affected by drug and alcohol misuse, mental health problems, and those with learning disabilities, right across England and Wales. And Victor has promised to give us his most off-the-wall ideas for this session.
Well, I mean, I don't know about off the wall, but I don't know. Actually, I wasn't lobbying on behalf of Turning Point. I actually asked him if we'd have a meeting with a load of children who were carers. We never talk about children who are carers, and children who are carers actually are a significant number of carers. I don't know. The choice thing for me sounds a bit like truth speak. I think that we need a bit of a reality check about what choice actually means for a lot of people. For Turning Point, we were just talking to my friend here from KeyRing, who just met with his friend. What we are facing is a spiral down in price. So local authorities are ringing us up and saying, unless you're prepared to reduce your price by 30, 40, 50, 60%, we're going to put it out to tender. Right? Now, in those circumstances, you have to think, well, who are we providing service for? Is it possible that we could be cheaper? Because, well, I've got no problem being cheaper. But there's a point where you also think, you know what, you can't provide this service to these people any cheaper. And we have said, we can't do it, we're not going to do it, we've called their bluff. And we've walked away from services, and one of the things I've said to directors of adult social care, who are becoming increasingly more ruthless, not because of ruthless people, it's just because they're placed in a ruthless situation, where they have no choice. I've said to them, well, we can't do it, I'll see you on the front page of the News of the World. And I mean it. I think that people, so those clients of that authority, I don't think they're going to have a lot of choice, to be honest. And I'm very sympathetic to the chap who was talking about direct payments and the amount, the work, the reality of the work that's involved. Because I have some sympathy. I've spoken to people who actually find themselves working twice as hard and sucked into a system they never wanted to be involved in, which is called employer. And as an employer, I can tell you, people is tricky. And I think that there are all kinds of issues around terms and conditions of those being employed, around abuse. What happens? How do you protect the employer and the employed from abuse? And I say this with all due respect, and have a romantic view of people with learning disabilities and people at the sharp end of the inverse care law, social care challenges. They can be the abused and they can be the abuser. And both things are quite finely balanced. So I want to start, basically I want to say we need to look at this with clear, logical eyes, because there's an awful lot of romance around the choice agenda. I'm a great fan of the micro-enterprise, and indeed Turning Point, through its connected care services, have produced many such enterprises. And the framework for doing so within a community must be guided by some principles. Because you know what, I don't want the BNP running my social care services, and it won't happen because the river flat. It happens subtly. It happens within the confines of an unstructured free-for-all. That's what you get in some areas, and that worries me. So there has to be some way of government, and I think we have a problem at the moment with government, because government needs central control, and none of us want that, don't we? We all want to sort of hang loose and not be centrally controlled. But I think there's a role for government. I think there's a role for the state in ensuring that we have equality of access, some outcome responsibility, that that my public money isn't going on services that don't move people's lives, the needle of their lives towards improvement. And I think we need to think about that before we simply say, you know what, the keys to the safe is 30 foot up, and whoever can jump the highest gets them. And that's my choice thing, and it may seem negative or not, rah choice go, but I think we do need to pull back a bit, because we're at a time when the pressure on public service budgets means that the introduction of choice, as a little fizzing tablet dropped into that water, means that actually those hardened adult social care directors are seeing it as an opportunity to cut costs. I just got to be honest with you. And we're also seeing, rather than the opening up of markets to organisations like mine and KeyRing and yours, which I think would be a positive solution to not only improve choice but in a lot of ways practice, and it's not just me saying that, there's a lot of research to show that up. What we're seeing is exactly the opposite, and I pray in it the events, the effects of what happened to the Surrey nurses, who are the very pinnacle of choice-led, community-based organisation run by nurses, set up to run the health visiting service, very well respected by the local community. As soon as a tender goes out, they lost it to an organisation that had no track record, as far as I can see, in the delivery of community health services, didn't talk about choice, and won it on, as far as I'm concerned, circumstances that are still questionable in my mind. So, in summary, I would say, let's just assume we're all up for choice, right? And I am up for choice. I've got no problem with it, all right? It's a good thing, like being against sin. I've got no problem with it, right? But let's, as adults and as people of knowledge, just take it step by step, keep the client at the centre and make no assumptions about them, because choice forced upon people is no choice at all. Choice that lacks resource is no choice at all. Choice that restricts access to the market and therefore access to service is no choice at all. It's a fantasy, and I don't deal in fantasies. Enough said.
Thank you very much. So I think we're going to take questions for the remaining speakers all at the end, while you digest what Victor said, which leads really nicely onto David Boyle, who's worked for the New Economics Foundation in many roles since 1987, including helping to launch time banking, with publications including Funny Money, The Tyranny of Numbers, Authenticity and Money Matters. And David's the independent reviewer in the review of barriers to choice in public services. So over to you, David.
Thank you very much. Well, you may well ask by somebody who wrote Funny Money. Should have possibly been asked by the government. to look at choice. But anyway, there we are. The government, the Treasury and the Cabinet Office have asked me to do an independent review of choice in public services. And the basic problem is this, that there is vast amounts of academic literature on choice that you can wade through. It tells you what happens in theory when you offer choice in competition. It tells you what happens in Idaho when you do it, or what happens when they did it in some small town in Denmark many decades ago. What there isn't is very much evidence about what actually happens on the ground in England. It's England I'm supposed to be looking at, when people are given the choice of things in public services. Is that what do they use it? Do they actually not have it? Do they actually prefer something else? Very little evidence on that, and that's what I've got to find out and make some recommendations in the new year. So I rather wanted to sort of broaden this out slightly and look more sort of generally at public services. I'm constantly being told that it's too complicated to talk generally about public services as a whole, and that is true. But there are nonetheless some themes, I think, that's coming out for me as I wander around the country on these endless train journeys to do roundtables to talk to users of public services. And of course, one of the things is that I cannot possibly really look at every public service, so I'm kind of concentrating on schools, hospitals and social care. And even there, it's quite a lot. So I just wanted to talk about 4 things that have struck me. They're not the only things, but and I don't know what the solutions are to these, but I throw them out, and I'm echoing in some ways what's been said already. There is clearly a problem of navigation, of information about choice in any public services, and social care in particular. Where do you go? And in the beginnings of all these pilot choices in schools and hospitals and social care, there used to be choice navigators, choice advisors, and I occasionally run across new titles. There's one I've got here. What was this one? There's Effective Transitions Personal Advisors. There are still some of those. Community-based intensive support advisors. There are still some of those. But there aren't actually any choice advisors. They were quite popular, but they're professionals and they therefore are too expensive, and they've gone. So people, have you? Fantastic. Oh, good. Well, no, I've met the Turning Point navigators, and I'm really interested in what's happening there. But somehow we have to get into the system. Some means, and it has to be more than just a website with graphs and information. Even a website that crunches information together is not enough for everybody. Somebody you can talk to who can advise you. And that's across the whole area. And part of that problem is the problem of fractured public services. And I was thinking about this particularly. Am I reviewing public services as they are now, when quite clearly they're in a state of huge flux? Or am I looking at them as they're going to be in 5 years' time? Which, of course, I don't really know. But clearly, somebody was telling me at a round table last week that looking after somebody with learning abilities, their front doorbell was rung 7 times in one day by different departments in the local council, and who all use different forms, who all require different answers to questions, and some of them are the same, but in different ways. And by the end, they've really just given up on any kind of help at all. And that is also unsustainable financially, I think. I don't think that sort of fractured service is going to last. But equally, it's not quite clear what's going to happen in the future. So that's the first one. And then the second one is how you drive choice into the system if that's what we want, by giving people the power to demand it. And I've had such a variety of responses in my roundtables about people who are receiving personal budgets or want to receive personal budgets. There are some for whom their local authority thrusts personal budgets upon them whether they like it or not. There are some, Bradford springs to mind, where if you ask for a personal budget, you're told it takes 2 years to process it. And you therefore lose the will to live. So there is a problem there, I think. The third thing is, which I'm quite interested in this because this is where I came from, which is, and you're offered all this choice, but you're actually really looking for a choice of something else, a different option. It's what personal budgets are supposed to provide for you. But the lists get ever longer, month by month, of things you're not allowed to choose. And for fear of the Daily Mail as much as anything else. And I remember the story, this is going back some years, of the man who had to pay somebody to go to the pub with him to be his friend every Friday. Well, I can think of cheaper ways of organising that, through time banks, through other kinds of volunteering, where you can use that money for something else, if necessary. But that's not an option, because they don't exist. So, and what about the option, the choice to give something back? I think that's maybe a glib thing to say, but equally, we're talking about people here who've been on the receiving end of public services their entire lives, and have never been asked to give anything back, and for whom that message is perhaps subconsciously that they have nothing to give. That's not true. We desperately need them as well as everybody else if we're ever going to keep public services on going. And the final thing I was going to talk about was the political problem, which is we're offering choice to people when that's not actually quite what they're being offered. The word is choice, but if you strip away the rhetoric of choice, so much underneath the financial architecture is completely different, designed for something completely different. So when people are not actually getting quite what they're expecting, that's not very surprising. So I was at I was at another round table about health a couple of weeks ago in Leeds, and the first person who spoke said what somebody always says, which is that your entire review is entirely based on misapprehension. I don't want choice, I want a good local hospital. And fair enough, I understand that point of view. But the next person who spoke, who was a patient, said, I would have moved to another country if I could have escaped my consultant who was rude to me. And I understand that perfectly well. You know, that choice which is in your back pocket if you ever need it. If your children are bullied, if your doctor is unpleasant to you, or something. You don't actually have that in the system. That's what the middle classes get by being difficult. And yet that is also choice in a sense. And it's the worlds away from the official choice, which is of 7 identical hospitals, when you're not feeling very well, and when making a decision is a bit stressful, and when you're worried you're going to make the wrong one. And I'm not knocking that. That's an important way of driving competition through the system. But it isn't the only way of doing a choice. So, if you've got any answers to those, please write them down for me.
Brilliant, thank you, David. Trevor, Brocklebank has a broad and impressive career as an entrepreneur in the IT industry before founding the care agency Home Instead. Trevor is going to talk to us next.
Hello. I got involved in care because my granddad got really bad care. I was amazed. It was my first experience in the sector. He had different carers turning up 4 or 5 times a day, food that he wouldn't eat was thrown in front of him. He was diabetic, his health deteriorated, and he was in and out of hospital until suddenly he passed away. And we just wanted someone to go in a couple of hours a day, cook him a decent meal, do some basic cleaning, take him out for his pension and prescription, and the same person Monday to Friday, so if his health suffered or something changed, they'd recognise it, get the phone, and we could go over. And I was amazed we just couldn't find someone to provide what I thought was a basic service everyone was entitled to. We look after about 6,500 people a week now to 124 offices, and about 2,000 of those are on direct payments. And we quite often fill in the sort of respite care where someone's going away for a few days, or someone's suddenly sick and they need to go to the dentist. So it could just be 2 hours of care, and that's all we ever do for that client. So it's a very flexible service. We don't do block contracts. We won't do 15-minute calls because we're very much focused on companionship care. A lot of our carers are in the 70s themselves because they're not doing manual hoisting, a lot of the manual handling type activities. There's a whole new marketplace opening up in terms of employment opportunities. But the biggest challenge we have is this disconnect with the local authority on what's happening with the way policy is meant to be interpreted. So we're told you can't take a direct payment and use a company, you have to take a PA. Well, we know that's not the case. You can't top up, whereas some people would rather pay an extra 50p an hour. We had a lady with a dog, and the social worker said, you have to get rid of the dog because you can't walk it. That dog's a best friend, it's a companion. So she took a direct payment, and we took the dog for a walk every day. And then the social worker came back and said, well, if you can use your direct payment to walk your dog, obviously you don't need that package, so we'll reduce the size of it. Another lady who sadly, she died, her husband died, and she lost her driving licence in the same month. And she became very isolated. Rather than care going in the mornings and afternoons, she said, well, I don't want to get up in 15 minutes, I've just got longer to feel sorry for myself, I want to go out. So she got 2 single beds, she now gets dressed by balancing herself between those, hugely important for her dignity and her self-respect, and the direct payment. We take her out once a week, she sees her friends, we do a big shop at Tesco's there, and she's really integrated back into society. And none of that's rocket science, it's not there. It's basic understanding what people want. But again, in that case, we had a review, the direct payment's going to go. The Minister talked about the twins. We lose an awful lot of clients when they move to continuing healthcare because it's 50p an hour less there. And we lost a number of clients in Sheffield. The total saving to the PCT was about £2,000 a month, and quite a few of those are end-of-life cases. By the time they've done assessment, introduced new carers, the overall cost of doing that would be far in excess of what was saved. They're not least the upset to the family of losing carers who in many cases have been there for many, many years. The preferred supplier list is a big issue for us, where you can only have direct payment from someone on the preferred supplier list. And that list was closed 5 years ago, and they're all people doing a very different type of care. Now, we're not right for everybody, far from it, but there ought to be far more collaboration between different types of providers, quite often with 2 or 3 providers going in, providing different types of services. You find that in every other sector, and it amazed me when I came into the care environment to find this very competitive. It's one size fits all. I think that's really encouraged by the local authority with a block contract, and you either get your contract or you go bust. So it's that implementation element to me that's really, really important.
Thanks very much, Trevor. There's wealth of practical sort of nitty-gritty issues that we need to get a grip on, and I think we'll be reporting back to the Minister, even though he isn't there to hear them. So thank you very much. Karyn Kirkpatrick is CEO of KeyRing, and one of the leading experts in supporting the inclusion of people with learning disabilities, was part of the Valuing People Now programme in the Department of Health, and is our final speaker.
Okay, well, hard to be the last speaker with such interesting comments from my colleagues here. But I specifically wanted to talk about community, because we're talking here about social care, and we're talking about personalisation. I utterly, thoroughly support the concepts of personalisation. But one of the things that we have noticed in KeyRing is that the principles of personalisation tend to focus on the individual in need and thinking about how we're going to support that person. But of course, people don't come isolated and on their own. People are part of their family, if they've got a family, maybe some friends, but they're certainly part of a neighbourhood. They will be somewhere, they're living somewhere. And we're not taking into account what support can be used and harnessed from that wider environment. A lot of the changes, and Alex has referred to this, around personalisation has been transformational in how services support and work with the people they support. It's made a massive difference, I think, for lots of people in their experience in relating to those organisations. But it hasn't really done very much about their relationships with their communities. It doesn't mean that they have more friends, or they have more connections, or they have other places to go to. Once the service gets involved, there's a danger, but it all comes funneled through that service provider, and you're slightly removed from real life. Now, KeyRing, we've always been an organisation that, whilst we deliver a service to people who need support, we've always approached it from a community development angle. So we've always started from a slightly different way of supporting people. And Norman mentioned about personal budgets being a really powerful mechanism for affecting change and people having greater choice. Well, I suppose one of the things I was thinking about was, well, when Putting People First came out, that was quite exciting. We all were very thrilled about the concepts of, people are going to get really good advice, information. There's going to be a focus on developing supportive and inclusive communities. That would be fantastic. We're going to focus on and invest in prevention, so people need less support because they get support earlier on, just the right amount. And then we have choice and control through your personal budget. And at the time, I think all these elements were considered to be equal value. But actually, it was personal budgets that grabbed everybody's attention and focus, and an awful lot of time and effort went on to building an infrastructure and a system and a process to manage money in this way. And I think one of the things that's really clear to me, that personal budgets do influence demand. People are starting to ask for different things, but it doesn't of itself influence supply. It doesn't shape the supply of what's out there. So people's opportunities to choose are really quite limited. So I think here we are in 2012. From our point of view at KeyRing, we certainly see that a lot of people have personal budgets. They don't know they've got a personal budget. It's just a local authority paying for what they've always paid for from us, but just from a different pot. That's the truth of the matter. In KeyRing, we support people with mild, moderate learning disabilities, with mental health support needs. All of them have the capacity to manage a personal budget, a direct payment. Very, very rarely get it offered. It just isn't on the table. You can have a personal budget, it will be a managed one for you. It just isn't there. It's not a discussion. And actually it's quite difficult because quite often people's funding pot comes from several little places, or when they get assessed they have such a tiny amount of money they can't use it in the way that they want. And we've also got a huge problem, I think, where people at the moment live in fear of cuts. They feel that they might lose services that they feel that are really hard won. They've campaigned to get what they've got. They're certainly not going to let it go easily. But actually, we do need to be having a really full and frank discussion about how can we provide people with opportunities to develop skills so that they require less support. We have to be honest about it. An awful lot of people are over-supported. An awful lot of money is not channeled in ways that are helpful or productive for individuals. We need to think about how that money is spent. And oh gosh, Trevor, thank you. Just went straight in my head. I was really interested in hearing about your stories about how people use their direct payments, because actually we talk a lot about choice in social care, but actually when you sit down and talk to people and you say to them, you know, here are your choices, what people actually want to choose is an ordinary life. They'd like to just get on with their lives. They want to have a dog and for it to be walked if they can no longer manage that. They just want ordinary things that everybody aspires to. So incredibly difficult to then construct, for a local authority to construct a range of choices to give people an ordinary life. You need to start the other way around. And I suppose my final point, I have one point, is at the moment we've got really good under personalisation about when we're planning with an individual, we need to think about them in their community and in their wider relationships. But we're a really long way from considering how personal budgets can enhance the communities in which they're spent. At the moment, personal budgets, where they're being directed to be spent on particular services and particular providers, that money is not touching that local community. And if we were more imaginative about it, in a neighbourhood, a personal budget could be supporting a whole range of activities that support everybody that live in that community. Finish on that.
Fantastic, thank you. So at the beginning I promised you this wouldn't be the same old social care discussion, and I'm very grateful to the speakers for delivering on my rash promise on which they weren't consulted. So thank you. We've had lots of really interesting and challenging. We've gone into some depth, I think, and some reality around what is often quite a glib subject of choice. So we have got time for a few questions or comments, and please do keep them brief. So I'm going to start, Emma, because you haven't spoken yet.
Okay, thank you.
And if people could say who you are.
Yes. I'm Emma Smell. I'm a Senior Policy Officer at Carers Trust, formerly Princess Royal Trust for Carers and Crossroads Care. My question is maybe a bit awkward, and it's two-part. The first thing I just wanted to say was that evidence on carers and personal budgets is that, like with service users and all people with access to personal budgets, there's a huge amount of variation in implementation. Obviously, that's been referenced by speakers today. You know, things we find as carers don't even know that they exist, that they're even receiving one, it might be managed, and they're not informed about their eligibility at all, which is a huge problem. But we also know that actually where carers are receiving personal budgets, it is improving outcomes in key areas of their well-being and health, which is incredibly, shows there is incredible potential. So in terms of that range of implementation, my question is twofold. One is, what is the role of government actually shaping this market, which at the moment is not providing choice or necessarily improving outcomes for all people? And the second part of that question is actually, what is the role of independent, voluntary and community organisations, so that a range of providers, in also doing just that, in actually ensuring that people have the so-called choice that we're that we're aspiring to, but also actually improves outcomes. We've heard a lot about choice and a little bit less about outcomes today.
Okay, thank you. And I was interested in what you were saying, Victor, that you were sort of, it felt like you were setting up an opposition between the idea of a kind of a free-for-all of individual choice and a role for government. And I do wonder whether there is a third way, which is more around the citizen and community group empowerment and actually citizens' role, and kind of the localism agenda, I guess, around that as well. Shall we take a couple more questions and then get back to responses? So, Paul.
Yep. Okay. Paul Jenkins from Rethink Mental Illness. Very much enjoyed the contributions from the speakers. I think we're in an interesting phase in this policy. I think we have to get beyond the glib presentation of personalisation and choice. I'm personally a very strong supporter of what it can offer people with mental health problems. But we're facing up, I think, 3 challenges, one of which is the financial circumstances we find ourselves in, I think, are having some significant perverse impact in the way that personalisation and direct payments are played out. I don't think personalisation and direct payments save money per se. I think they offer the opportunity to have money spent in better ways for better outcomes. So I think we have to be very wary of glib actions that use to save money. Second, there's a big issue obviously about market development. One of the things that always gets missed, I think, is the focus of using personalisation and direct payments as collective tools. So engaging with groups of service users and carers to create services they want together, where their buying power is significant and where they can actually, either in a co-production model or commission somebody else, create those services. And then the third thing is clearly some of the horrible stories you hear about bureaucracy and the rules that put around it. That can have no place in this policy being played out. And that is something that government can play a role in shaking out.
Brilliant, thank you. And
Nick Riker from the MS Society. It's almost not knowing where to start, but I particularly like Victor's presentation of choice as being this kind of fantasy, because in a way it's a fantasy which has been driven from the political class. It hasn't emerged from the doorsteps of the UK. This is a kind of upper middle class political fantasy which is being perpetrated around the system. And Mandate did a piece of research recently which found, for example, that personal budgets make not a jot of difference to the extent to which people feel in control of their lives. Not a jot of difference. And the difference that needs to be made is not one about the market. Already we've heard more questions about diversifying the market. It's about changing a lot of the culture which exists within those organisations, local authorities, for example, social care organisations. Many of the providers that would want those contracts need to change their culture. And it's not about throwing out paternalism, it's about taking the best of paternalism with the focus on the individual and arriving at something in between that helps people to make choices, that actually works with people to help find solutions that will improve their lives. It's certainly not about privatisation and the market, and that's my great fear, and that's what's currently being driven by central government.
Okay, thank you. So we've had there's a couple of questions with some similar themes, and something we seem to keep coming back to, which is what is the role, whose job is it to shape the market? If commissioning as we know it is dead and gone, top-down commissioning, who does the shaping role that used to be done by the commissioner? And Paul, or maybe didn't used to be done by the commissioner, but Paul's suggestion, which chimes with me a lot, is the idea of actually collective purchasing power. I spend lots and lots of money individually at Tesco's, and they have no interest in my views on what's on their shelves, but the owner of my corner shop has a few more views, and if I really want to take charge, I probably need to do something on eBay myself. So I was interested in whether speakers had a top one market shaping idea, and Victor, you look like you've got one brewing there.
I think commissioning. You know, bring back commissioning.
Bring back commissioning.
I mean,
what does that mean?
Well, you know, most people talk about commissioning. If you ask people individually, we'll give you different definitions of what it is, and most of those definitions revolve around purchasing. It's not commissioning. I very rarely see commissioning. Commissioning is the means by which you understand the needs of an individual and or a community such that you can build a platform for procurement. It is not the same thing. And true commissioning should empower both individuals and communities, not only to design the services that they need, but to participate in the delivery of the services. And governments have avoided, I don't know why, but they just have, and probably because it's difficult, they've avoided tackling that issue. And one of the reasons why it's difficult is that where you do create those kinds of commissioning structures, and communities do take part, you end up with things like service navigators. You end up with completely redesigned services that meet the needs of the community in ways that the current bureaucracy and the current state of services, which frankly in care, social care, are commodified. You know, it's a commodity. That's why your relative has got such a terrible service. It's because it's a commodity. Somebody's getting paid X amount for doing 15 minutes. Actually, they'll do 40. You know, and unless you can recreate that sense of commissioning, accountability, and processes in the community, what you get is purchasing. What's worrying me at the moment is that we're not paying enough attention to the technologies that work in producing true commissioning that is community-led. I'm very much with you. I think that the choice agenda is we're just starting to understand, and I think some of the work that's been done by David, and hopefully, you know, we're starting to understand what it means, and it doesn't mean the minister making a speech about choice.
Yeah, go on, Karyn, please.
I just want to say we work in 45 local authorities across England and Wales, and I know one local authority that have really, really consciously given great thought and attention to how they develop choice and empowerment of their communities, and so they have taken an approach in the last couple of years which has been a total transformation of how they do all their adult social care, an absolute rethink, a total reorganisation, and we're really at the beginning of it. So here we are 2 years in, and I would say that at the moment most choice for people is still led by the social worker and the funding panel, but they know where they're going. You know, this is where we're at now because this is where we've got to in the journey, but they're putting in so much attention to, they've got community workers or officers in tiny bits of the neighbourhoods looking at community solutions and community resolution when things go wrong. They've invested huge amounts of money in developing information and advice and really informing their citizens. That, you know, they've looked at it at every layer, and that's absolutely unusual, and they've still got a long way to go. So I think that there is...
Are you going to name them, given that you're not naming and shaming, you're actually very positive about them?
Oh, I can. Well, I will. It's Warsaw.
I was going to say it's Warsaw, you as well.
Because they've really taken some risks, actually. I think that's
not the only ones.
No, they're slightly depressing away from you. It was Warsaw.
Yeah.
Leeds have got, yeah. So, Trevor, do you want to come on this point? And we are sort of almost out of time. We'll understand if you exercise your choice to leave for another event, but also feel free to stay with us for 5 minutes or so.
I think there's a fundamental disconnect between national government and local government. The national government is saying you need to have choice and this is what you need to do, local authorities. They're all saying we totally agree, but you need to give us more funding. And they're saying, well, there isn't any more funding, you have to do it with that. In that case, well, so we've broken the old system, but we haven't replaced it with the new system, which is why people try to shape it themselves and commissioning is looking in different ways. So there needs to be a stronger leadership on this is exactly what it looks like. And I do think there needs to be some edict on you can't do this, you can't do this.
And what would be, if there was that edict, what would be the one thing that you'd like it to say you can do and one thing you'd like it to say you can't do that would really sort of shape the market up for you?
Get rid of preferred supplier lists.
Preferred supplier lists.
And just remove those.
Second that one.
Going back to some of the questions about...
Define commissioning. Define commissioning as I've defined it. That would make a massive shift in the way and hold the commissioners accountable for applying that definition to the way services are designed.
And maybe there's an opportunity in the Karyn support bill for us collectively to try and shape the thinking around that. Sorry, and you have one more?
No, I think the country bit is absolutely spot on. There's too much, there's too many meetings where there's lots of debate around the theoretical, this is what personal choice is. Well, actually, it's practically, how's this going to work and how's it going to reach the people who need it.
Thank you. David, did you want to come in with a final point?
I don't have a magic bullet, and if I did, I was going to keep it till January.
You don't want to waste it.
But I did. I want to take issue with Nick slightly, because although I understand exactly where you're coming from on this, there is a paradox at the heart of all this, which is that the disadvantaged section of the population are both the people who sell polling over and over again that they are most keen on choice, and they're also both the people who are most suspicious of it. Because, of course, they know, like we know, that in practice it means something slightly different. That the rhetoric is peculiar, and that they are supposed to be playing a game of driving competition. And there is, let's face it, a difference between competition and choice. They could mean the same, often they do, but you can have the situation, and let's face it, if you have the misfortune of looking for a school for your children in London, as I have been recently, there's a situation where there's lots of competition and no choice whatever. Well, not no choice, I exaggerate. You'll see the problem. And so I wouldn't want to lose the choice, the ideal of choice, the ideal of a human, flexible system in our public services. That's what we're aiming at, I think.
Okay, thank you. I'm going to try and summarise. We've been positive about the principles of choice and empowerment, and I was particularly struck by your phrase, Aidan, that something along the lines of those with the least control and power should have the most choice. And I think efforts to redress power imbalances and the iniquities of the previous system that couldn't even recognise somebody as an individual, let alone that they had choices, has been a very noble motive in this agenda, alongside perhaps some of the more suspicious motives that we've talked about. But the system has created new power imbalances, new iniquities. I think we should never underestimate the ability of the status quo to assimilate something new and radical like direct payments into making it look as much as possible like what we had before. Just been moving the money around in a different way with a different name, and it's even led to new lies, truth speak in Victor's phrase, and some of those lies being that there isn't actually a choice if you've got no choice of providers out there, and also I think something quite deep here about we're pretending that people can have rights without responsibilities, and I think some of the most interesting territory in this for me is what are those hidden responsibilities that actually, if we could start to name and engage with, we might be able to offer something that looks more realistically like a kind of choice that was a partnership and a new kind of relationship between citizens, families and communities. And that might be the key to a good life. So I'm going to leave it there by thanking ResPublica, our hosts, our speakers, and most of all you for finding us even though we weren't in the programme. So thank you very much.